Kim, and my research topic is over surgical doctors' work shift. My research question is, how does surgical doctors' long shift of work negatively affect their health? After researching, I found out that extended working hours negatively impact surgical doctors' sleep, physical health, and mental health. Many doctors are dissatisfied with their job, which is due to overloads of work, and it is shown that sleep deprivation is one of the main reasons how the work environment has negatively affected their work, and that could also impact the patient's care and safety. There is a high level of emotional exhaustion among doctors, and when doctors are working longer hours than they should need to, it could negatively affect their well-being, not just now, but also in the future. And work-related stress is harmful, which can lead to health problems and even serious traumas. How does long shift of work affect surgical doctors? Longer working hours have a negative impact on surgical doctors' mental health. First-year residents in Japan worked from 80 hours or more per week, and by the end of the third month of residency, 62.6% of the residents newly developed depressive symptoms, and high loads of work can be a major source of stress that can lead into depression. Stress causes anxiety, depression, burnouts, alcoholism, and even in extreme cases, it can lead to suicide. Depressed residents make 6.2 times more mistakes each month than those who are not depressed. Long shift of work negatively affect the physical health. It was found that longer work hour may contribute to higher body fat percentage and lower aerobic fitness. High level of emotional exhaustion can cause lower back pain, neck pain, headaches, and high blood pressure. Physical stress is one of the main causes of the physical health, and it is caused by exclusive standing during operation, and it can even cause low energy and tense muscles. Extending surgical work shift can reduce extending surgical work shift causes sleep deprivation and can reduce patients' care and safety. Lack of sleep has a negative impact on doctors' executive functioning, which has an effect of a range of higher order and a cognitive process that are important for their performance and patient safety. The total number of hours of sleep that surgical doctors are getting is a range from 0 through 4 hours each day. Anyone would be at a risk of having cognitive functioning after working such long hours with little sleep in a stressful and mentally challenging environment. Some may argue that some surgery takes longer, requiring surgeons to work longer. However, if surgical doctor must work longer hours, it will cause sleep deprivation, which can be harmful to the patients in and out of operation. And not only that, it can also jeopardize the surgeon's physical and mental health. And in conclusion, working long hours of shift can negatively affect the physical and mental health, and it can also cause sleep deprivation among surgical doctors. Thank you.
Let's see. So, first question. What evidence did you gather that you were not able to use, and why did you choose not to use it?
The evidence that I gathered during my research was about the night shift worker for surgical doctors. I didn't choose to use that because I started finding out, because my last point was looking for sleep deprivation and patient safety during operations, and it shows that night shift had more tough time, but I was on like the end of my research, so I didn't have enough time to research more about the night shift, and so I didn't decided to use that.
Okay. All right. And for your second question, what additional questions emerged from your research, and why would you find those to be important?
Additional question that emerged during my research was to look more about the on-calls hour, because it was important for me because if you're in on-call hours, it's like you're working 24-hour shifts, and I think that if I look more into deep to those about the questions for on-call hours of surgeons, it'll look better on my research, and yeah.
Okay, thank you.